All right. Well, thank you all for joining us today. Really honored to be part of this and one of the panelists. I'll give you just a little bit of background into my own history and experience with the device that you're going to learn about today. So I'm Dr. Earl Bryant, boarded in emergency medicine, kind of had an eclectic career path over the years. I did a little bit of hyperbarics. I was an exam grader for the ECFMG. Oh, and by the way, in the spirit of true transparency, I am a paid consultant today, but that's easy for me because I've used this technology for so long and I believe in it so strongly that it's easy really for me to speak to its attributes and what it can do for your patients. So I'm excited about it. At any rate, I opened a clinical practice in 2008 that involved cosmetic surgeries and Botox and lasers. And after a while, and that practice did well, but after a while, I wanted to evolve a little bit, noticing my own health problems that were coming up as I was an aging male. So I started moving into men's health and then started doing hormone replacement and hair restoration. And then I got into the ED game. Some of my male patients were requesting ED therapy. So we started with the PD5 inhibitors, the Levitras, the Viagras, things you're familiar with, and we did Trimix. But I met John and was able to learn all about this device that you're going to be learning about today. You'll hear it termed shock wave therapy, but it's really not an electrical shock. It's a mechanical wave that's kind of permeated through the tissues as you place the technology up on your skin. But this shock wave I learned about and started using it on my patients. And I wanted to make sure it was safe, and it wasn't well used. I mean, it wasn't well known or used for ED much in the United States. And there were only a dozen or so international studies regarding this type of therapy for ED. So I was a little skeptical. I wanted to make sure that technology was safe, and it was. I looked into it. It's for this type of unfocused wave device, it's FDA approved as a class 1 device, so your technologist can use it. It doesn't have to be used by doctors, and it can be used very easily by technologists, easy to train on. So I started using this device and felt after about 6 months working with patients how happy they were with their outcomes. And so then I thought, okay, this device is safe. Now I've determined that it's effective. And I began to get a lot of happy patients coming back in to see me. I began
So,
also.
Earl, I have a question. Were there other, aesthetics is such a big market for vendors. Were there other devices that you bought and paid for that you just aren't using anymore? You know how we go to seminars as doctors and buy stuff. So,
Yeah, I bought in, when I started developing. I don't even want to tell you how much money I spent on different technologies, but I can tell you what I had. I had two cool sculpting machines. I had a hair restoration machine. I had a smart lipo. I had Vaser. I had 3 different lasers. So you can imagine the money I've spent. And these technologies they started about $100,000. And so I was all in. And I can tell you that over time, the shockwave device that John is going to be talking about was my workhorse. That was my go-to.
got it. Well, my clients are not like that. If they buy that, I tell them it's on you. You made a mistake. You didn't check with me first. Uh, they typically don't go big with the machines and then try to figure out how to market it later. They always start with marketing and sales, and then let me find a machine that can do that. So our group works a little bit different, but I'm glad you experienced that pain, because like I know, that the machine is not the thing that people are buying. It's not the machine.
Absolutely. And it's part of the support. I mean, one of the things that I think John's really developed well are complete packages with his program, with the device, so that from start to finish, from soup to nuts, I think it's a comprehensive package to be able to hit the ground running from day one.
Yeah, I mean, I have them right here. I don't know if you guys can see me, but I have his packaging. Can you see this? Probably not, but it's written up beautifully. And it goes over almost everything: marketing in the office, marketing to the patients, marketing to the public, videos, to the patient, to educate them, to go after the patient list. So this is truly turnkey, John. It's unbelievable what you've created, and you've done it
Right.
in each one of these niches. So that's why I'm impressed. I mean, the machine is the machine.
The
Um,
machine is the tool to make it happen.
yeah, but the way this is written up, I've not seen it done this well before.
Thank you.
So go ahead, Doc. I didn't mean to cut you off.
No, absolutely. John, do you want to flip? Maybe we'll go to the next slide and we'll talk about
Sure.
the science. So as we talked just a little bit about earlier, this isn't an electrical shock. This shockwave therapy, and sometimes I like to say acoustic wave because when you tell patients shockwave therapy, they tend to be a little alarmed. So I try and use acoustic wave, but shockwave slips out. So forgive me if that happens. But this acoustic wave therapy relies on this energy that permeates down through the tissues. And what it does is it stimulates this kind of biologic cascade of all your body's own natural healing processes into this focused area of treatment. So what you see immediately is you see this nitric oxide release creating this great vasodilatation. And this brings in, when you get vasodilated like this, you're also stimulating cytokines, vascular endothelial, all kinds of growth factors, VEGF or vascular endothelial growth factor, platelet-derived growth factor, insulin-like growth factor, fibroblasts. So what you're doing is stimulating the body to recreate and build new tissues, new healthy tissues, new blood vessels. And that's really the process of all of this. And typically, just so you know, this isn't a process that happens overnight. As you know, the body, even young bodies take a while to heal, older bodies even more so. But what we rely on is a series of treatments over a set period of time, usually a few weeks, and we can go into more protocols later on. But a series of treatments over a few weeks, and then you wait a few months to see this full biologic cascade kind of pan out. And here's some of the things that you can see. You can see angiogenesis, where you're seeing new blood vessels being created. And you can see in these tissue samples the before and afters of these new blood vessels that are created. eNOS, which is endothelial nitric oxide synthase, vasodilates and creates, bigger blood vessels. And you can see that in the before and afters there. Vascular endothelial growth factor is huge in growing blood vessels. And so we need this product in there. And again, this is all stimulated by the machine to have your body bring all these tissues to the site of, bring all these components to the site of healing. And we also say PCNA, which is responsible for DNA repair and rejuvenation. So it breaks up a lot of this fibrotic tissue. It stimulates kind of chronic, indurated, long-term non-healing tissues that kind of re-energizes them and pulls all these chemicals in, these body's own chemicals, to do the work. Here's a little bit of a cartoon, and I actually like the picture on the right a little bit more than the left. John, you probably agree with me in saying that the energy, the way the energy radiates out from that end of that device is a little bit more accurate. It's more of a cone shape than it is a linear shape, and it kind of cones out through the different areas of tissue, through the different layers. And you can see that it's stimulating a lot of different processes. And one of the things that I really love about this is, in addition to stimulating blood vessel growth and vascular endothelial growth factor and all these different factors, it also mobilizes stem cells to that particular area of injury. Stem cells have a tendency to home to a site of injury, and what can they do? They can donate their own mitochondria if the cells are sick. They can actually become new cells, new tendon cells or tenocytes. They can deliver, the old term used to be exosomes, but we call them nanoparticles, all this healing factors that the stem cells can deliver. And this device pulls those stem cells into that area of injury. So it does a lot
Dr.
of
Bryant,
Yep.
I have a lot of clients that have cash neuropathy clinics, and one of the oral nutritional supplements is nitrous oxide. And I see that this is creating nitrous oxide. How do you compare the two? Because one, if I'm swallowing something, it's got to go through my gut, through my this, through my that, to get down to the spot, compared to if I have neuropathy in the lower leg, wouldn't this be a direct A to B response?
Yeah, absolutely. Delivery system's important, and you really can't deliver effectively nitric oxide in any other form than the way the body does naturally. There's no more effective way to do it. And again, what you're doing is you're stimulating the body to create its own process for doing that. So yeah, I mean, I think it's much more effective than other
Got
ways.
it. Okay, yep.
So these are some of the studies. When as I hinted at earlier, when I first started this, there were only about a dozen international studies on ED out in the literature. Now there are hundreds. If you do a PubMed search, you can find hundreds of studies now, and because I think it's become a hot topic, and people recognize the efficacy of this particular treatment. You can go down, it talks a little bit about I don't know if I can, let me move this so I can see it a little bit better. They're talking about in the second study, I'll just use it as an example. They use shim score, and it's really important, especially with erectile dysfunction, to be able to quantify for men how they're doing. And so what I always had them do is I'd have them do a shim score, which is a numeric score, basically calculating the quality of their erection. And then I do that at the completion of their therapy. And what I often found is that there's a huge difference when you say, if you'll pardon the pun, huge, but if you take a man who was not able to penetrate his partner, and then after rounds of this therapy, now they're able to penetrate their partner, that is huge. Again, if you pardon the pun, but the bottom line is that there are so many studies out there that support this particular technology. As you can see on the last, oh, I'm sorry, John, just one last thing about the last two studies comment on PDE5 inhibitors, and we're all familiar with those, the Viagras, the Levitras. What you'll find, all of those tools, whether it be injections of Trimix, whether it be your favorite Viagra type medication, all of those tools are basically working to try and maximize the dysfunctional tissues that are there. They don't build new tissues. This is the only technology that will build new blood vessels, that will build new healthy tissues to be able to maintain that erection. And I always tell patients this: we'll try and get you off of those medications, but at the very least, we'll make those medications work a lot better for you. You can reduce your doses and sometimes get off those medications altogether. So I think that that's a big win for men. These are vascular flow studies. So this is done with an ultrasound, and I'm not going to bore you with too much of the detail, but the bottom line is, if you look at the before and after studies, you can see on the before side, you can see these peak waves, and that's your peak systolic velocity. That's the blood that's being pushed into the penis that causes the erection. The more blood you push into the penis, the better the erection quality is. You can see both before and after treatments, and you can see that if you read the small print, you can look at the peak systolic velocity, which is a measurement of that blood flow into the penis. And you can see after treatments, it's significantly improved when you compare it to the previous. And also, almost equally important, is you get less leak out, which means that the blood flow into the penis is so much better. It's tamponading off the blood that flows back into the body from the penis. So more blood in, less blood out means for a better erection overall. And that's really what we're looking at with these flow studies. One last thing, if you'll take a look at the dates of the studies, one is a 2017 and one, I believe, is a 2018 study. So this was done a year later. So, the goal is to be able to get these men tuned up and have that sustainable. What I always used to do in my practice would say, we'll get you your 6 treatments, we'll wait a few months, and then come in every once in a while for your tune-ups to be able to keep those tissues as healthy and performing as well as possible for your age that we can. The great part about,
Wow.
yeah, the great part about shockwave therapy is when you look at what shockwave therapy really does, when it gets down and builds new blood vessels, heals connective tissues, helps improve the structure of skin in general. You can see that it can be applied to a lot of different scenarios, a lot of different clinical scenarios. Here you see it's being used with cellulite, and we know that cellulite, 85% of women regardless of race, suffer from cellulite. And it can be alarming and concerning. Women develop it more than men because of the structural differences in the way that our fat resides underneath the skin.
Doc, I the results are unbelievable. What what's a typical care plan for something like this?
Yep. What you want to do is you want to map out certain areas of concern that the patients have.
Uh-huh.
And in this particular case, what they did, and this, she was part of a study where they do treatments both kind of horizontally across the leg and vertically up and down, about 1,000 shots, 6 treatments twice a week. Each treatment takes about 15 minutes or so to deliver.
So
And
this was done, these results were done in 6 visits?
yes,
Oh my gosh. Wow.
yep.
Okay. Wow. Yeah, I paid for a machine that's supposed to do that, 150K. And it was a few years ago, but nothing like that. But it was for cellulite. It just didn't work that way.
Well, Steve, I think I told you part of my practice was a cosmetic surgery practice, and so I did high def liposuction and all of these, and so plenty of women came in with this complaint, and it's a tricky a tricky problem to try and solve. There's really not much out there in the marketplace. There's a lot of claims. There's not much out there in the marketplace that's truly effective, and I know I spent a ton of money trying to find it, and I found that. There's a few different great elements of this particular technology. Number one, it's non-invasive. Number two, it's effective. The pay and it's easy to perform, again, by a technologist. And after that series of treatments, you've got a happy patient who's returning, 6 months later to get a tune-up maybe, or maybe they find another area of their body that needs to be treated as well. So there's a lot of cross-pollination, between these therapies. Maybe that same patient a year later comes in with a frozen shoulder or a calcific tendonitis that they want treatment from. You can also treat that as well. All right, so this is, we haven't talked about this, but these are cosmetic indications for shockwave therapy or
I
acoustic.
have never heard of shockwave facials ever.
Yeah, it's interesting. And again, if you go back to what acoustic wave therapy does for skin tissues in general, you can see that the diverse amount of applications you can use it for. Here, I love especially the before and after on the right, because I performed a ton of Botox and filler for my patients, and I can tell you that is a phenomenal. You can't get those results with Botox filler and laser treatments that you can see on the before and after with this lady's face.
What's the number of treatments here?
There's a few, John, you know this case a little bit better than I do. I believe it was 8 treatments, but I'll let
Yes,
John.
8 treatments over a 4-week period.
Yeah, that's unbelievable, guys. I mean, I know cosmetics. I know what the stuff costs. I
Yeah.
know what the chemical peels are. I know what hiring an aesthetic technician costs, being independent contractors and ripping half the money. As long as I mean, I just think this is unbelievable. And if I sent that out as an email or a text before and after, all I'd have to put was 8 visits,
Store
8 treatments. I could
bought
put
this
whatever
here.
number I want underneath it. Now, I don't know what you charge, Doc, but
Yeah.
people
Well,
will pay. Ugh.
I'll tell you what I used to charge. So for
Yep.
to try and get a result like this, I would start out with a fractional CO2 therapy. That was about $2,000 to $2,500 for the patient.
Mhm.
Then I was with and that, remember that I have a very expensive laser too that I've got to pay for. So I've got I've got a fractional CO2 laser. Then I would follow it up with Botox and fillers. And that meant not only would the patients have to go through a week's worth of healing, from the laser, then they've got to get shot up by Botox needles and filler needles that are invasive and uncomfortable for the patient. So for a lot of different reasons, when I saw what this therapy could do for facial tissue, I was really blown away.
Yeah,
The
it's great.
manufacturer brought this, I'm sorry to interrupt. The manufacturer brought this to the US in April of last year. It's brand new in the US. It's been a huge hit throughout Europe. And for some reason, Europe's always 10 years ahead of us here in the US.
Yeah, I mean, just this alone, I could upsell any of my female patients to this. Without marketing. I'm just, and I know my doctors that are on it going, yeah, I could sell that.
I'm expecting this to be a huge hit here in the US.
Yeah, I think it's awesome. All right, what's next? What else do we got?
So on this is a before and after treatment of a calcific shoulder tendonitis.
Yeah,
And
I
these,
see it.
I'm sure you guys see this all the time.
So
And
we're used to this, Doc.
yeah,
Dr. Brian,
yeah,
we're used to this one.
this is your wheelhouse, right?
We know this one. We already know this works. Before this, we would inject juice. But
Mm-hmm.
now that we have these machines, you know, the juice costs $1,200.
Yep.
So when
Well,
we have this,
had
we
this.
can,
I had this problem. I play pickleball a lot, and this was really problematic for me. This is a result that you can see. I think rather impressive result of that, complete disintegration of that calcific kind of area there, and with people wanting to stay more active now, not wanting surgery, want minimal downtime. I think it's a great addition for any musculoskeletal chronic, overuse kind of injury. It's a great addition to the practice.
so what's the typical treatment plan for this? We're still in that 6 to 8 range.
Yeah,
So this
you can certainly do
three
that.
treatments
Go ahead.
once a week for 3 weeks. This patient here.
Yeah, that's incredible. I love it. Okay, what else do I got?
So, kind of in closing, and we can talk as much as you want about the science behind it. We've kind of tracked over that, and I'm happy to answer any questions. But just to highlight, this impacts these different problems that I think this therapy can treat. Impacts a lot of different patient groups. We start seeing ED in men around age 40, and for every decade, you see about a 10% increase. So it starts at about 40% for men age 40 or so. 50% of men at age 50 or over have erectile dysfunction on up. And we know how important sexual health is throughout our lifetimes. 85% of all women, I discussed that earlier, regardless of ethnicity, will suffer from cellulite. It's a problem that I think bothers them when they go out in public and when they're in different types of clothing that show that. You can see that up to 33% of the world's population lives with chronic pain. And so for all of these different problems, I think that acoustic shockwave therapy is a wonderful either standalone treatment or as an adjunct to other therapies that you're using.
Dr. Brian, I did have a question just come in, and maybe it's a John question. Obviously, we're treating three totally separate things. Do they need to buy 3 machines, John, in order to do this? Or
It's
no?
all one device, different treatment tips, different accessories, but all one device.
So you just change the head out, probably?
Change the treatment tip. Certainly for the facial conditions, there's specialty tips created by the manufacturer.
I got it. So, but I'm only buying one machine, and I
Correct.
just changed it out. So some of the other corporations, John, this is my question. The heads run out after like 2,000 shocks, and then I got to buy another one for $3,500. Is that the case with this?
The tip for the face, the soft tip, is per patient. So you would use for the 8 treatments for one patient, you would use one tip for that patient and then either file it away for future use or throw it in the garbage. That's a $75 part per patient that you
Well,
need for
that's a
the.
lot different than 3,500. I'm okay
Yeah,
with $75.
but that's reusable for that one patient.
Got it. Yeah,
And
no, that's great.
I can speak to the durability of this product too, Steve, mainly because I've had so many different products over the years give me problems. And I can tell you that it's a very durable machine.
Gotcha. Okay, good. Because there's a black market, by the way, with Chinese crap flying around, and it breaks. And I I like getting a good deal, but I don't like when I look at the overhead of a business model. My true overhead is my marketing dollars, my salesperson, and my staff. If that's all working and my machine goes down, I'm screwed. So I don't want to have a Alibaba machine. So we're good there.
So I'm just going to splash up the different components in these different packages that we have for each of these four unique.
Yeah, let's start with the Regen Pulse package because a lot of the doctors already have this. So let's look at some of that.
So as you can see here, we have office signage, we have an email content, we have training. First and foremost, all conditions are backed by extensive training, both in-house, in your office, as well as video library. So it's important that not only you know how to use the machine today, but with staff turnover, it's real important to be able to not go back to square one when and if your primary technician were to leave you.
So John, I have some questions. I'm reading the brochure. So it says with the package, I have wall displays that come with it. I have custom whiteboard videos that I can put on my website and email out to patients. I have some of the, I guess, disability things, the shim test. It looks like you have a ton of campaigns here.
Yeah, I mean, we have all of the admin forms that are needed, from consent forms, procedure notes, shim score, just all of the admin that's handled, patient communication, patient brochures, patient presentation, email campaign. We provide
But for
signage.
most people, John, like I'm just going to tell you because I do this a lot. So you have number 5, you have an exact formula. Send out the first email notification campaign, sent out the practice page base 3 times in the first 4 weeks, and you have the emails already created with the videos.
Correct.
Yeah, most guys have a video and they go, Doc, use it how you want it. Like I'm saying, this is a system, not like an encyclopedia and the doctor picks. So that's pretty impressive there.
If you'd like, I could show you an example of one of the whiteboard videos.
I would love to see that. Yeah.
So let me pull it up on
Do we
this.
have to buy those separately, John?
That's all part of the packages.
Okay.
It's a beautiful summer day, and the family wants to head to the beach. What should be an easy decision to pack a lunch and put on a bathing suit has just turned into anxiety. Cellulite. It is reported that cellulite affects over 85% of women. Cellulite affects lifestyle and clothing choices and can keep women from engaging in otherwise enjoyable activities. There are no diets that can eliminate cellulite, and countless trips to the gym will have little to no effect. However, there is a solution: acoustic wave therapy, also known as ESWT and shockwave. Thanks to this technology, patients are experiencing unprecedented long-term results and significantly improving their quality of life. This completely non-invasive treatment can bring back that youthful look. Ask your medical provider today.
Yeah, that's impressive.
So we provide you with the packages include three videos of that nature for cellulite, 3 for facial rejuvenation, 1 for ED, and 1 for musculoskeletal pain.
I got it. And then wow. Well, Dr. Bryant, I know you've worked with John. What do if let's just say musculoskeletal, or let's do, I mean, I really like the cellulite thing a lot because I don't see it anywhere. And then I consider that to be a facial too. What do you sell that package for? What's it typical?
Well, the reality is it's all really a supply and demand issue. But my feeling is, and typically, I don't know, John, everybody's a little bit different. John might have better national averages, but in general, $250-ish a treatment. But again, that's market dependent. But I can tell you that the space you're competing in is, especially with cellulite, are creams, are laser therapies, are things that I think are not particularly effective at all for cellulite.
Dr. Bryant, what do those packages cost? What are we competing against?
You're competing against, I think, both invasive and non-invasive approaches. So, the packages might be a bit cheaper, but I think along with that cost goes the decreased efficacy. I mean, I think that anything that really works, you're able to charge more for, because as I think, as we know, the beauty industry, people will pay a lot of money to look good. And so I think that you're looking at, I don't know, John, do you have an idea nationally what packages are going for? Like I said, I was charging, $250-ish a treatment. But I'd lean on John for that.
Yeah, national average, you're looking at 3 to 4,000 for a series of 6 treatments.
Yeah, and that's what I was gonna say, Dr. Bryant. I could sell that for a lot more, and I would not ever sell it per treatment. I would sell a package, and the package would be, hey, it's $39.95. If you pay today, it's $29.95.
Yeah,
I mean,
I just haven't, I don't know if I recalled saying, but I closed my office practice in 2021, and so I'm semi-retired now. And still, be honest with you, I'm not up to on current market prices, but I think it's entirely reasonable. I think people will pay it.
yeah, well, I know that I could sell it, because I know what liposuction costs, and
Yep.
I know that that doesn't work long term, but people pay it constantly for tummy tucks, gullets, whatever, fat. So I like that. So, John, would you say that the majority of these packages are regardless of body part, is selling somewhere between 2,500 and $5,000?
Other than musculoskeletal pain, yes, I would agree with that.
And you're saying musculoskeletal is the cheapest
It is.
because it's oversaturated.
It's the initial introduction of this device in the US was for musculoskeletal pain, and those prices were established years ago. You're looking at
Right.
$750 for 3 treatments, but you're talking about 3 5-minute treatments as well.
No, it's a good deal. If I had that machine, what I want is, I want to do cellulite and wrinkles. I already have that girl, that woman's in my practice. She's just laying face down. All I got to do is go, hey, before and after. I promise, I could sell it. So if you were to lease the package, what are the doctors looking at for hard costs for the package on a lease?
You're looking at about $1,200 a month on a 5-year lease.
So $1,200.
Yeah.
Obviously, they could pay it in full, but you have financing for that. So basically, if they sold one package, they pay for their lease. Literally one.
And then
Literally
some, yeah.
one.
I just returned from a dermatology show in Miami Beach 2 weekends ago, and there was a parade of women dermatologists that came up to our booth and said, please tell me this works for cellulite, because nothing works for cellulite. And, the studies prove it. There are almost a dozen studies out there for cellulite using the Storz device that prove the efficacy of this device. So I think you can, with cellulite alone, you get rid of one woman's cellulite, she's telling all her girlfriends.
Yeah, and for my doctors that are out there right now, and you have large, like you're making good money in your semi-glutide weight loss practices, when I say this is an exact Lego piece, that is the exact same customer, I promise you, all you have to do is as they start losing weight, you just say, oh, by the way, we have something for wrinkles and we have something for cellulite, and it's non-invasive. They're going to spend that money someplace. It's the same buyer. So, well, John, I really don't have any other questions. I like, there's nothing that I don't like about it. I like the cost. I like that we're marketing different stuff than competing against knee and neuropathy. Like this is a different niche. And I don't need to make a lot of sales. Like, let's just say my marketing budget for this is like $3,500. If I sell 3 of these in a month, I'm in profit. So I have no problem with my clients getting into these packages. The other thing is, if they don't have the machine, they can add on to their current phys med practice and do shoulders and knees without spending any overhead. I mean, just in hyaluronic acid for knees, uh, that syringe is costing me $1.20 with limited results. So
I think the
um,
great, Steve, the great thing too is you're not taking anything away. You can still use all those therapies, but it's a great augmentation tool because ultimately what make patients come back are happy patients, patients that feel, the treatment was effective. So I think you can use this tool throughout all the different lines of business or different patient problems
but
that you
but
have.
the difference is John is ahead of the curve. He's hit 2 new markets that no one's hitting with this type of device. That market has already been established by the bullshit. I say it's like the lady at Macy's in the white coat, for aesthetics. It's our that market's established with almost spa stuff, and to be able to get those results in 4 to 6 visits, I think you're going to beat the shit out of those injectable spa type places. I think you're going to really knock it out of the park.
Absolutely. And we talked about cellulite. Cellulite is there are no good therapies. And I know because I was in the business for a long time. And talking about the charging, if you charge per area and just say, look, we can, here's your area of concern, don't divide it up as a per treatment kind of cost, but just say for this area to significantly reduce the cellulite, this area we charge by area, it's going to be X number of dollars. I did the same thing with liposuction. You charge by area.
Yeah. Well, hey, I appreciate you, Dr. Brian, coming on and explaining it. I like that you're similar to my clients, that you've also purchased other things and kind of found your way into what works for not only the patient but the business model, because you probably had good results with some of the other stuff, but it maybe didn't have a great result for you as a provider. This one, with that price point, it really does. And most of my doctors can afford to put a marketing campaign, and they're not stuck in a 90-day treatment program. I mean, what John was saying is like everything's around 6 visits. So for everything, I like it.